All right, y'all. So we got Zach back on here for the January reflection. We're coming a few weeks late. We had some other obligations that we couldn't quite get our recording in until now. But I'll start off quick, I guess. So my January kind of finished up in acute care. We had our live patient exam, and I really enjoyed my final weeks in acute care. I had a blast. Kind of was finally comfortable with the systems and being on the neuro only floors and kind of just how to have my flow, I guess. So I felt like I could be productive and see a lot of patients, and also feel like I was giving good interventions and not feel like I was walking around like a chicken with my head cut off. So January was great. I really enjoyed finishing up in acute care, and now that it's February, I started inpatient rehab. But yeah, I don't know. I did not think I wanted to do acute care at all, and now I could maybe see myself doing acute care for a little bit. So that glad my life patient exam was over. That was like a big stressor. But so that was pretty much my January. But I'd love to hear about how January in California was. I'm sure it wasn't snowy like it was here.
Yeah, well, first of all, the weather's been in the about low 60s, mid 50s every day. Rain here and there, but no snow in the air, so I can't complain about that.
Yeah.
But I agree. I feel like I'm starting to get into a little bit more of a rhythm, and starting to feel a little bit more comfortable on a day-to-day basis. And I actually just had my first live patient exam this past Thursday, actually, which went well. It was a case I was comfortable with. I mean, it was shoulder, which is kind of my go-to joint at this point. But it was a very movement-based exam, which is kind of what I love, and continuing to explore more and more. So, but overall, it went well. But it was nice to get some constructive feedback as well, and then got a lot of time before the next one. But I've also been doing a couple other interventions per se too. I finished I took a BFR continuing education course this past month too, from Mike Reinhold, which was awesome. And now I'm kind of just waiting for the right patient to do it on here. So excited for that. I used the Ultra G treadmill for the other first time the other day, which was really cool. On a couple, I've one ACL repair and then another meniscectomy. Just to they're both starting to kind of get into that phase 3 of their rehab, so kind of starting to initiate more of running program. So that's really cool to kind of utilize that on more of a patient base rather than just hopping in it and trying to take a load off, but for someone that was actually very beneficial and you could see the excitement in their face too, like being able to run, even though that it was at limited capacity, but still just being able to be on a treadmill again. So that was pretty cool. So yeah, I'd say overall that it's kind of starting to get into more of a rhythm. Lectures are picking back up, which is cool. We've had a hip exam and treatment lectures, and then we've had a couple of knee ones recently as well. So those have all been kind of going well, and they tried to tailor our evals to the lectures that we're having too, so that we can take the things that we learn right from the lecture and bring them right into the clinic. So that's been very helpful to kind of learn it and then apply it right away.
Yeah, that's nice. We finished up our like online lecture series that we started back in June, July. I don't know. Feels like it was forever ago. So we're starting to. We kind of finished up our second module for that, and which is kind of nice now that we have like all the didactic. It's just like going back through and reviewing it for exams that we have coming up. But excited to start working on the research project in February and the next couple of months here. Still kind of trying to figure out how I want to refine what exactly I want to do, because every idea I have is too big and can't be accomplished in a few months. But it kind of feels like that's kind of the story of my life sometimes. So I I'm excited to keep getting into that. Kind of excited to be done with the lectures a little bit. I like learning, but I just like, I don't know, the whole classroom sitting down kind of thing is getting old. So yeah, January was a good month. Excited for the rest of residency and to be getting into the new setting in inpatient rehab. At least for myself, I know you're going to be kind of for the most part in the same setting, but it sounds like maybe transitioning to some different diagnoses or body regions.
Mm-hmm. Yeah, and things are slowly starting to kind of open up here as far as the opportunities that we have as well. We did get to, the other resident and I got to go to a MSK lab down at Stanford with the medical students last week. That was just kind of a knee and low back, kind of more of their lab almost. So it was kind of doing special tests and that kind of stuff. So we helped with that, which was really cool. So some of those things are starting to slowly resurface. So I'm hopeful that those will continue to come about and can share more of those experiences in the upcoming reflections as well.
Yeah, ours are our other experiences are still kind of shut down right now, but they're hopeful they'll start opening up. So we'll see. But all right, Zach. Well, I thank you for coming on and sharing your January reflection. We'll do it again come March or for February. Yeah.
Sounds good.
All right.
See ya.